Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everybody. You're listening to Policy and Rights here on Depictions Media Radio, and I'm your host, Michael Clogs. So, still a hot topic, getting vaccinated, to get vaccinated, not to get vaccinated, is a big hot topic question right now. And here in Canada and in the U.S., it would seem that the answer to getting everybody vaccinated is to issue mandates and place restrictions on those who have not been vaccinated. And it's a hot button item, and it has caused separation on either side of those who really don't believe that we ever that we have a pandemic running right now, and those who are very fearful that that I'm going to get sick and I'm just going to simply die, that this bug is going to kill me if I get it. And those two extremes have managed to pull our society into half. One half going one way, one half going the other way. And in the middle of all that, our governments have, rather than trying to bridge the gap between everybody and help ease the tensions, they would seem to be adding into it with mandates, restrictions, and ID cards. That is one of the hot button items of today's broadcast. That goes along with that. Those who are on one side of this pandemic, they're protesting, which it is in Canada and in the United States. It is our legal right to have peaceful protests and demonstrations against things that, or to voice our opinion about things that are happening, issues that are happening around us. And that there's nothing wrong with those peaceful protests. It is when the protests interrupt things, or they interrupt areas that could save people's lives. And that leads us to some of the protests have been mounted in front of hospitals, emergency rooms, and things like that. And that's not exactly the place to hold these demonstrations, because, believe it or not, those people are there to do a job. They're doing the job that they're hired to do, and we need them to keep doing their job because they're saving lives. And that leads us to one of the things that with the WHO press conference, and we're going to listen to some of that in a moment. But healthcare workers, one, they need to be protected. Two, we need more of them. We need more people going into these areas. And the pandemic has, because of frustrations and not being able to save as many lives as they wanted to, just people, they think that are climbing out of the woods because of the pandemic. in the end take a turn for the worse, a dramatic turn to the worse, and they wind up sending that person to the morgue. I mean, I'm being blunt about it, but it's literally some of what has been happening around the world. And when people get too frustrated, they burn out, they find depressions, and other mental health things start to appear within groups like that. We hear about with soldiers PTSD. Well, PTSD can happen in any stressful situation where you just don't know how to process it. And as a result, we are losing healthcare workers to these stressors. So we're going to hear about how we need more and how we should be trying to protect our healthcare workers so that, hey, they're the ones in the end that keep us safe from disease. They keep us safe from injuries. They put us back together again. It is the human body repair shop, is a hospital. And we need those services to be in place. We need those services to be free of protesters so that people can be helped. So let's listen to some of what Dr. Tedros and the WHO have to say about our healthcare workers and healthcare systems that need to be in place around the world so that we can save more lives. Thank you for listening to Depictions Media Radio.
Thank you, Margarita. Good morning, good afternoon, and good evening. I have often said that universal health coverage and health security are two sides of the same coin. Both depend on health systems that are resilient, efficient, and effective, and able to surge to respond to emergencies. Health systems like that are a vital first line of defense against outbreaks with epidemic and pandemic potential. But they're also essential for promoting health, preventive communicable and non-communicable diseases, and for reducing inequalities and inequities. This week, WHO published a new position paper on building resilient health systems at the foundation of socio-economic recovery and development. The position paper outlines 7 policy recommendations with specific actions in each area. We urge all countries to implement these recommendations and reap their benefits. The backbone of every health system is its workforce, the people who deliver the services on which we rely at some point in our lives. The pandemic is a powerful demonstration of just how much we rely on health workers and how vulnerable we all are when the people who protect our health are themselves unprotected. A new WHO working paper estimates that 115,000 health workers may have died from COVID-19 between January 2020 and May this year. That's why it's essential that health workers are prioritized for vaccination. Data from 119 countries suggests that on average, 2 in 5 health and care workers globally are fully vaccinated. But of course, that average masks huge differences across regions and economic groupings. In Africa, less than 1 in 10 health workers have been fully vaccinated. Meanwhile, in most high-income countries, more than 80% of health workers are fully vaccinated. Today, WHO and several partner organizations have issued a statement calling for action to protect health and care workers around the world. First, we call on all countries to improve monitoring and reporting of infections and deaths among health and care workers. Second, we call on all countries to ensure all health and care workers are protected and supported with safe and healthy working conditions, regular salaries, pay equity, appropriate education, career opportunities, and social protection. Third, we call on all countries to ensure that all health and care workers in every country are prioritized for COVID-19 vaccines alongside other at-risk groups. Today, I'm pleased to be joined by two women who represent millions of health workers around the world. Dr. Annette Kennedy, President of the International Council of Nurses, and Dr. Heidi Stensmeieren, the President of the World Medical Association, which represents the world's physicians. Thank you both for joining us. Annette, you have the floor, and then we will hear from Heidi. Annette?
Dr. Kennedy, you have to unmute, please.
You have to unmute, Annette.
I tried.
Now, yes, that's good.
We okay now?
Yes, you're okay. Please.
Thank you, Dr. Tedros, and thank you, WHO, for giving me the opportunity to speak on behalf of the International Council of Nurses and on behalf of the 27 million nurses that I represent. I wish it was a better day today. I wish it was a day that we would celebrate that all healthcare workers had been vaccinated or that we had come to the end of COVID-19. But it is not that day. It is a day when we are hearing about 115,000 health workers who have died, many needlessly, many we could have saved. And we know from ICN that that's an underestimate of the number that have actually died. We welcome the publication of the data, but we still grieve for those who have lost their lives. They have sacrificed their lives for other people that they have tried to save. Is it that healthcare workers' lives mean so little? Is that we cannot look after them and protect them? Is it that governments do not realize that they have a duty of care to their health workers, the most valuable resource? It's a shocking indictment of governments. It's a shocking indictment of their lack of duty of care to protect healthcare care workers who have paid the ultimate sacrifice with their lives. Nurses, and I speak for nurses, although we're talking about all healthcare workers, went into this pandemic with 6 million nurses short. Not alone that, but globally, the world was not prepared for the pandemic. We had weak health systems, it had unresilient health systems. And now we find that nurses have left orphan children and they have left many family members behind without compensation or without recompense because it's not looked as an occupational health injury. We have been calling for systematic standardized data collection for over a year and a half. We know from our associations, 135 associations throughout the world, that many nurses have become infected and many have died. We also know that nurses are burnt out. They have given their all for a year and a half or 2 years. They have worked long hours. They have worked without breaks, and they have been called to do duty without protective equipment and without support. They are now burnt out. They're devastated. they are physically and mentally exhausted, and there's a prediction that 10% of them will leave within a very short time. Add to the 6 million nurses that we are short. Our estimates show that in the next 10 years or less, that we will lose 4.7 million nurses who are due to retire before 2020, mainly from the North America and from the European countries. That makes 10.7 million nurses. Add 10% more to that from the associations that we know that have said there is an intention of at least 10% who will leave the profession. That makes 13 million nurses. 13 million is 50% of the current workforce. No health system can survive without that many nurses. No health system can even function without 50% of its workforce. And we have seen that nurses are now going into different jobs already. The most educated of our profession are looking for agency work so that they can make 2, 3, and 4 times the salary, but work a third of the time. That reduces the number in the workforce. So, what are governments going to do? What are they going to do to protect our workforce? If you were to see a plane crash every day for a week, the industry would close down. In fact, the world would be investigating it. Yet there's no investigation to the 115,000 healthcare workers who have died. Are we not valuable? Are we not valuable to society? Are we not valuable because we put our lives at risk? There is something seriously wrong, and we all have responsibility. And what we will find is that the lack of sharing of vaccines across the world, because countries are only vaccinating their own, and they're going into booster doses, and they have vaccines that have not been used because they have a choice, and they have decided that through misinformation or disinformation, they're not using their vaccines. But they are left unused, and yet we have other countries crying out for vaccines, particularly healthcare workers. And yet those same countries would be aggressively recruiting very quickly nurses from those countries who cannot afford to lose their nurses or their healthcare workers. So I am sad. I am devastated. I am upset that so many people have lost their lives and that still our governments fail to protect the healthcare workers that they need most. So when is this going to stop? When are they going to stand up to the plate and take their responsibilities seriously? They need to vaccinate all their healthcare workers. They need to invest, and they need to retain their health workforce. So I urge all governments, I urge all people, and I even urge the media to ensure that we make this clear. There is another crisis coming down the tracks, and that is a shortage of healthcare workers. Thank you.
Thank you, Annette. And Heidi, over to you.
Thank you, Dr. Tedros, and thank you for the invitation to speak on behalf of the World Health Professional Alliance and the World Health Medical Association. Thank you especially for the support of the necessity to vaccinate health and care workers, individuals who are not only left alone in frontline, but not always heard. So with those words, we want to put forward that we thank the WHO for the initiative raised and regret together with you that many member nations have not provided the data necessary to really document and understand the impact of the pandemic on health personnel and health care. Data, aggregated data, is a resource needed so that we can be more resilient now and in the future. We have learned to use data, and we do have the possibility to collect data. Then it's time that it's being done. We have all experienced and witnessed the harm the pandemic has done not only to our patients, but also to us and our colleagues, many of which we have seen suffering or even dying. Some still left with long COVID problems. Left alone with shortages in material, often due to disrupted supply chains or unfortunately even hoarding. Left alone with staff shortages, unfortunately insufficient staffing already before the pandemic, but during the pandemic getting really worse. So both material shortages and staff shortages are partly consequences of economic planning and regimes, which have squeezed out the last reserves of healthcare systems. And as I mentioned before, we saw it even before the pandemic, and we also had knowledge about it. On-demand delivery left the systems with lack of resource. We were not resilient enough when the pandemic hit us. Those priorities, political priorities and choices turned out to be extremely costly, not only with a view to many lives lost, but also in the view of the economy and the health and welfare of our countries. Because healthcare is not a commodity to be acquired at the lowest price possible. Healthcare, including reserve capacities, are investments to the future. It's an insurance. It's the way we can be more resilient, just as you mentioned opening this meeting. So back to the working conditions. Working conditions, as pointed out earlier, has been inappropriate during the pandemic, and even the payment of the work during the pandemic has led to a higher attrition rate, and we will see even higher attrition in the future. This will be an obstacle and a challenge to achieve the necessary accessibility to the populations around the world, accessibility to healthcare. And unfortunately, to this we can add attacks and harassments to health and care workers during the pandemic. We have addressed this many times, but the calls to protect us against violence have unfortunately been widely ignored. And even here, documentation is important. So back to where I started, collecting data about the spread of public health threats is neither a luxury nor is it a national business. It is essential, and it is affecting us all. We owe respect to those colleagues who succumbed during the pandemic in order to serve their patients. They are truly heroes. Their families need our support, but we owe them more. We owe them not to make the same mistakes again. So, if there is a revision of the international health regulations coming up, or even better, if there will be a pandemic treaty, collecting and reporting the essential figures to observe, measure, and understand the public health emergency will be crucial, both to control but also to contain it. So we will say that complete, correct, and instant reporting should be part of our international collaboration. The WHO offers the right platform for this, and we would encourage all countries in the world to stand up for this. Without that, beating future pandemic will be more difficult, and with the risk of repeating what we have seen in the last 2 years. Thank you for this.
Thank you, Heidi, and also thank you to Annette. And thank you to both of your organizations also for your continuing partnership, to the International Council of Nurses and to World Medical Association. More than 10 months since the first vaccines were approved, the fact that millions of health workers still haven't been vaccinated is an indictment on the countries and companies that control the global supply of vaccines. High and upper middle income countries have now administered almost half as many booster shots as the total number of vaccines administered in low income countries. In 10 days' time, 20 people will meet in Rome with the ability to change that, the leaders of the G20 countries. Between now and then, roughly 500 million vaccine doses will be produced. That's the amount of additional doses we need to achieve our target of vaccinating 40% of the population of every country by the end of the year. 82 countries are at risk of missing that target. For 3/4 of those countries, it is simply a problem of insufficient supply. The other quarter of countries have some limitations in their ability to absorb vaccines, and we're working to address those problems. The target is reachable, but only if the countries and companies that control supply match their statements with actions right now. The barrier is not production. The barriers are politics and profit. The G20 countries have pledged to donate more than 1.2 billion doses to COVAX. So far, only 150 million have been delivered. For most donations, we have no timeline. We don't know what's coming and when. Manufacturers have not told us how much COVAX will receive or when we will receive it. We cannot have equity without transparency. Ahead of the G20 summit next week, we plan to publish new 12-month strategic plan and budget for the ACT Accelerator, which will set out the actions and resources needed to achieve our targets. It's clear what needs to happen. The countries that have already reached the 40% target, which includes all the G20 countries, must give their spot in the vaccine delivery queue to COVAX and AVAT. The G20 countries must fulfill their dose-sharing commitments immediately. Manufacturers must prioritize and fulfill their contracts with COVAX and AVAT as a matter of urgency, and be far more transparent about what's going where. And they must share know-how, technology, licenses, and waive intellectual property rights. We're not asking for charity. We're calling for a common sense investment in the global recovery. COVAX has the money and contacts to buy vaccines. What we don't have is any visibility on when the manufacturers will deliver. One of the clearest and strongest voices for the need to invest in vaccine equity is Gordon Brown, the former Prime Minister of the United Kingdom and WHO's Ambassador for Global Health Financing. And it's my great pleasure to welcome Gordon today. And Gordon, thank you for your continuing work and partnership and leadership. You have the floor.
Thank you. I want to start by thanking Annette and Heidi for their moving and challenging statements about the loss of 115,000 health workers so tragically lost during this COVID crisis. I count it a privilege to work with Dr. Tedros, who's just introduced me, and with his brilliant dedicated team. And I'm here today to issue a warning that in the ongoing race we are in between the virus and vaccines, we are once again at a moment of truth. And the next 10 days to October the 31st will be decisive. If at the G20 summit in Italy, the world's richest countries cannot mobilize an extraordinary and expedited airlift of doses to the unvaccinated and unprotected of the world, and do so starting immediately, an epidemiological, economic, and ethical dereliction of duty will shame us all. And we may have lost our last chance before winter to initiate what is urgently needed to save hundreds of thousands of lives, a globally coordinated, month-by-month operational plan and timetable that transfers what are unused vaccines we now hold in the richest countries of the world to the world's poorest countries that are in desperate need, as Dr. Tedros has said, of vaccines now. For it's urgent we close this yawning and unconscionable gap between the promises of vaccines that our richest countries have made and the painfully slow delivery of them to the poorest. And it's time to bring to an end a tragic and unacceptable but still growing divide between global north and global south, that by December, on current projections, the West will be stockpiling 600 million unused vaccines, and by February, almost 1 billion, that could starting today, if airlifted to the south, help prevent the loss of lives. To have the vaccines available in one half of the world and yet to deny them to the other half of the world is one of the greatest international public policy failures imaginable. And it's a moral catastrophe of historic proportions that will shock future generations. For if the G20, who hold the lion's share of vaccines, do not act to switch their stockpiled vaccines and delivery contracts from north to south, the World Health Organization's latest forecast is that there will be 200 million more COVID cases in the next year, 3/4 of them in the countries where most remain unvaccinated and unprotected, and 5 million lives hang in the balance. And if this were to be the case, we are only a little more than halfway through the damage caused by this pandemic. Now, in face of this crisis, with only 5% of adults vaccinated in Africa, just 1.4% in low-income countries, the first target of 10% vaccinated in all countries was not met by deadline day, September 30th. 56 countries did not reach 10%, 18 countries managed no more than 1% vaccinated. The failure is such that having made a promise to meet that September deadline, we're in mid-October still 200 million vaccines short. And the 40% adult vaccination target for December, confirmed only a few weeks ago at the Global Vaccine Summit, chaired to his great credit by President Biden, has, unless we act now, no chance of being met. Despite the heroic work of COVAX, the bulk purchasing agency, we still appear to be 500 million vaccines short to reach that 40% target. Now, since the start of the pandemic, the number of COVID cases has reached 242 million. And we'll say the World Health Organization almost double again to 440 million in 2022. The death toll is officially now at 4.9 million, and it could virtually double to an overall figure of nearly 10 million within the next year or more. So failing to vaccinate the world is self-defeating. It's against our self-interest. It's against all our security interests. The longer vaccine inequity persists, the more the virus will keep circulating and mutating, the greater the likelihood of the pandemic continuing uninhibited for at least another year, delaying our containment of COVID, prolonging the economic and social disruption the virus is causing. Now, Airfinity, the expert data research agency, are showing us that even if we account for boosters and vaccinating the over 12s and even younger, 240 million vaccines are lying today unused in the West. If we do not act and use them, the figure of vaccines either unused or about to be delivered under contract will exceed 400 million next month. By the end of December, 600 million. So the 500 million shortfall in vaccines that we've talked about can be bridged by transferring 500 million unused vaccines south by switching delivery contracts to do so. By February, the unused stock could be 1 billion. And what is more, Airfinity estimate that if we do not transfer these vaccines quickly, 100 million of these vaccines could pass their use-by date and expire and would have to be destroyed and wasted. But there is a way forward. In advance of the G20 on October the 30th, Western leaders should decide on a plan and a timetable to transfer the vaccines that are available from north to south. If this was agreed, then the other G20 members who also have unused vaccines could be persuaded to add their vaccines and switch their delivery contracts. And this would enable us to reach 40% vaccination rates in all countries by December. So we are now in a countdown to the start of the G20 under Prime Minister Draghi. The G20 is our chance to agree and coordinate an operational plan and a timetable to meet our vaccine targets and to make progress where previously we've fallen short. And of course, an extraordinary humanitarian effort is also needed, as Dr. Tedros has so eloquently said, with the World Bank, IMF, and other agencies making additional resources available to Act A and to the 91 hardest pressed countries to build the medical capacity they need and the staffing to administer the vaccines in urban and rural areas over the coming months. But friends, the alternative is unthinkable. A fractured world where bitterness at a two-track future grows, and where the disease spreads uninhibited in unprotected places, and then as it mutates, new variants threaten to infect even the fully vaccinated. It's in everybody's interest. And there is no greater cause today than us acting decisively now to bridge the unacceptable divide between the world's vaccine rich and the world's vaccine poor. Thank you very much.
Thank you. Thank you so much indeed, Gordon, for your leadership and advocacy. We can only hope the G20 countries hear your call. So thank you so much again, and I hope you will stay with us for the interaction with the media. And Margaret, back to you.
Okay, so continuing forward on our hot topic item of vaccination, to be vaccinated, not to be vaccinated, and Canada has issued, different provinces have been issuing vaccination ID cards. And now the federal government is introducing a program with a national vaccination passport. This passport can be used to travel on the planes, on a bus, or any of those things. Any of those modes of transportation that are governed by the Federal Ministry of Transportation. So, in a nutshell, is being vaccinated, it's like most healthcare, it is a private issue. It is not a matter of a public record. The different types of treatments and things that your doctor performs on you. Should the COVID-19 vaccine be a public thing? Should it be a matter of public record? And are these ID card programs actually segregating populations when our government should be helping populations? They should be helping people come together, be united, be part of a solidarity group. So, this is the big question about the vaccination ID cards. So let's listen to, we're going to listen to what Justin Trudeau and has to say about this topic. Along with that, the federal government is going to start repealing COVID supports. Now they're going to replace them with some newer programs that will end by May 7th of 2021 in most cases, but they're going to start repealing the COVID-19 supports. Now, according to statistics, that more jobs have been created after the vaccination programs have been introduced than there were before the pandemic first hit. So there are some arguments about how to keep support programs going and which programs need to be continued to be supported, because they want to introduce the idea of, hey, if you feel sick, don't go to work. There's other things that possibilities of lockdowns and things like that could happen, and they want to make sure that there is some sort of support in place for that in case there are a large number of breakout cases beyond the vaccination programs. So let's listen to what Justin Trudeau and Chrystia Freeland actually have to say about all that. Thank you for listening to Depictions Media Radio.
Morning, welcome, bienvenue à tous et toutes à Télé High. My name is Alex Munter. I am the CEO here at CHEO, and we are gathered, of course, this morning on the traditional unceded territory of the Algonquin Anishinaabe people. We acknowledge and honor their stewardship of this land since time immemorial, as we honor and recognize all First Nations, Inuit, and Métis people. 500,000 children a year are helped here at CHEO, coming from across eastern and northern Ontario, western Quebec, and Nunavut. And children are the unsung heroes of this pandemic. Children have made enormous sacrifices for their well-being and for our collective well-being. And here at CHEO, we are paying close attention to the impact of the pandemic on kids in terms of learning loss, impact on development, and on physical and mental health. We are focused on these issues, on responding to the needs of kids, and on working as hard as we can to help our community move past the pandemic and turn the page on COVID. And that means we have worked very closely with Ottawa Public Health and community pediatricians, our Kids Come First health team partners, to vaccinate kids 12 to 17. And as we speak, we have groups working, doing detailed logistical planning to be ready to run clinics in schools, in the community, and across our region for 5 to 11-year-olds so that they can be afforded a measure of protection that a vaccine represents, and that we can increase our community immunity and the safety of schools and our whole city and region. So we're very excited to hear what the Prime Minister and the Deputy Prime Minister will be announcing today. And on that note, it is really my very great pleasure to welcome to CHEO for the first time, I think, the Deputy Prime Minister of Canada and the Minister of Finance, Chrystia Freeland. And for a return visit to CHEO, and this is not a disclosure of personal health information since he said it publicly himself, but the Prime Minister is in fact the first Prime Minister of Canada to have been a patient at CHEO, but he's been back many times since. So welcome back, Prime Minister Trudeau. We're delighted to have you here.
Thank you, Alex, for your kind words, but also for your extraordinary work as President and CEO of the Children's Hospital of Eastern Ontario. I have fond memories of the amazing team here, but we have seen through this pandemic that you and the incredible team at CHEO really stepped up, as health workers did right across the country, to be there for our most vulnerable, to protect the community, and to support kids in very, very real ways. Chrystia and I had the opportunity to chat with some of the kids who are both patients and at school here at CHEO, and it really is extraordinary to see how resilient kids are. Faced with challenges, faced with crises, but it's all the more important, therefore, that we be there for them in every possible way to give them the supports they need, not just to get through this pandemic, but also to recognize everything that they're going to be able to contribute to our communities, our country, and our world over the coming decades if we make sure that we're giving them all the right supports and all the best opportunities for the future. Je suis très content d'être ici aujourd'hui avec la vice-première ministre pour faire 3 annonces importantes aujourd'hui. Les 2 premières, je vais les faire et je vais passer la parole à Chrystia pour la 3e annonce, mais on a des bonnes nouvelles pour les Canadiens aujourd'hui. As people know, Canada has been a world leader on vaccinations, and that's just part of what Canadians were able to do through this pandemic, where we saw everyone from frontline health workers to community workers to individual Canadians stepping up during this pandemic to be there for each other, to do the right things to get us through this. And it has culminated, of course, in vaccinations, as Canada is now among the world leaders in vaccination rates amongst eligible Canadians, that is, 12 and older. The government also, all the orders of government have been there to support Canadians, particularly on the federal side, where we scrambled to deliver PPE. We've scrambled to ensure that we have vaccines for everyone, and we're also ensuring booster shots for the coming years as they become necessary, listening to the expert advice that folks in NACI and other fields are going to be making on how we move forward. But when we talk about the high vaccination rates of Canadians, 82, 85, 87% in various jurisdictions of Canadians fully vaccinated, it's always eligible Canadians. Because we know, particularly those of us who are parents, like I am, of kids under 12, that not everyone can get vaccinated yet. We have heard that Pfizer has now submitted for regulatory approval at Health Canada a pediatric vaccine for kids 5 to 11. And this is great news. I can assure you that Health Canada is going to be examining attentively that submission. And even though I know parents are all going to be eager to get their kids vaccinated as quickly and as soon as possible, I want people to be patient because Health Canada is going to be taking the time necessary to ensure that, like all vaccines approved for use in Canada, vaccines approved for kids 5 to 11 will be fully safe and effective. It is extremely important that they go through all the full processes necessary so that every parent can have confidence when these vaccines do get approved that they will be safe for their children, to keep us all safe, to keep them safe, to keep our communities and schools safe as we move forward. And therefore, what I'm very pleased to be announcing today is that we have worked directly with Pfizer, and shortly after the time comes for Health Canada to approve those vaccines for pediatric use, we will receive millions of doses in Canada, enough to get all kids under between 5 and 11 vaccinated as quickly as possible. We will have the supply necessary to support every kid across the country from 5 to 11 with vaccinations as soon as possible after Health Canada approved it. C'est une bonne nouvelle aujourd'hui. Santé Canada, comme vous savez, est en train d'analyser les données et faire les processus rigoureux pour l'approbation du vaccin Pfizer pour les 5 à 11 ans. Et ils vont prendre le temps nécessaire pour s'assurer qu'il soit sécuritaire et efficace. Parce que tous les parents veulent que leurs enfants soient en sécurité, mais ils ne veulent pas prendre de risques non plus. Alors, vous pouvez savoir que si et quand Santé Canada va approuver l'utilisation du vaccin Pfizer pour les enfants, ça va être sécuritaire de le faire pour vos enfants. En même temps, je peux annoncer aujourd'hui qu'on a signé des ententes avec Pfizer pour que dès que ce soit approuvé pour utilisation au Canada, très peu après, nous allons recevoir assez de doses au Canada pour assurer la vaccination de tous les enfants au Canada de 5 à 11 ans. C'est une très bonne nouvelle pour tous les parents et tous les enfants à travers le pays parce que ça fait longtemps qu'on veut s'assurer que nos enfants aient la protection additionnelle que la vaccination leur donnera, comme plus que 80% des adultes au Canada ont déjà fait. Il y a quelques semaines, on a fait plusieurs promesses par rapport à nos priorités, par rapport à la vaccination, par rapport à la lutte contre la COVID. On a livré sur notre promesse d'assurer un mandat de vaccination obligatoire pour les trains et les avions, un mandat de vaccination obligatoire pour les travailleurs de la fonction publique. Et aujourd'hui, je suis content de pouvoir confirmer un troisième élément de cette promesse, c'est-à-dire la certification ou la preuve de vaccination uniforme pour les déplacements à l'international qui sera disponible à travers le pays. We made a commitment to ensure that there is a national standard for a proof-of-vaccination certificate that will be issued by every province and territory so that people can travel domestically, but particularly internationally. And today I'm happy to confirm that all provinces and territories have confirmed that they will be moving forward with a standardized national proof of vaccination. As of today, so far we have Saskatchewan, Ontario, Quebec, Nova Scotia, Newfoundland, and all three provinces, all three territories, Nunavut, Northwest Territories, and Yukon, who already have put into use the national standard for proof of vaccination. You can download it onto your phone, you can print it out, you can ask for a copy by mail if you don't have those capacities, but you are now able to show proofs of vaccination immediately in all those provinces, and all other provinces have agreed and are working hard to come online so that as Canadians look to start traveling again, there will be a standardized proof of vaccination certificate that, as we said, we will be picking up the tab for at the federal level to ensure that all provinces are able to do it. And we'll also move forward on our other commitments we made around vaccinations and safety and COVID, which is moving forward on legislation to keep healthcare workers safe from intimidation and being hassled. So we can end this pandemic and get back to the things we love. It's a reminder as well, as we move forward on all these measures, for folks who still haven't yet gotten their full vaccinations, please get yourself vaccinated. It's the way we can all get back to the things we love, avoid further lockdowns, and make sure that our economy comes roaring back and we're keeping our most vulnerable as protected as possible. Troisièmement, et je vais passer la parole d'ici très peu à Chrystia Freeland pour en parler plus longuement, mais par rapport à la relance et la reprise économique, on a vu des bonnes nouvelles. D'abord, le Canada a déjà repris 100% des emplois qu'on avait perdus depuis le début de la pandémie. On voit beaucoup d'entreprises, beaucoup de croissance reprendre à travers l'économie, mais on reconnaît qu'il y a encore des secteurs qui sont durement touchés. On voit par exemple l'industrie du tourisme, les restaurateurs, particulièrement dans les centres-villes, qui ont encore énormément de défis avec les implications de la COVID-19. Et on a fait une promesse très directe aux Canadiens qu'on allait être là pour les appuyer aussi longtemps que nécessaire, mais qu'on allait aussi être là pour assurer une relance économique forte et rapide. Et donc, je suis très, très content de pouvoir passer la parole maintenant à la ministre Freeland pour partager les éléments, les prochaines étapes de notre plan pour lutter contre la COVID-19 et appuyer les Canadiens tout en facilitant une reprise économique rapide et forte. Alors, je suis très content maintenant. I'm very happy now to pass the podium over to Chrystia Freeland. Chrystia.
Okay, good morning, everyone. Thank you, Prime Minister, and thank you, Prime Minister, for that great news about vaccines for children. That is really great news for children, for families, for schools, and for our economy. Quand la crise de la COVID a frappé, notre gouvernement a rapidement lancé divers programmes généraux afin d'amortir le plus grand choc économique du pays depuis la Grande Dépression. L'objectif était simple, prévenir autant que possible les séquelles économiques et aider les travailleurs et les employeurs à travers la pandémie et les restrictions qu'elle a amenées. D'un bout à l'autre du pays, ces programmes ont donné une bouffée d'oxygène aux travailleurs et aux entreprises. Ils ont protégé des millions d'emplois et aidé des centaines de milliers d'entreprises canadiennes à poursuivre leur activité au plus creux de la pandémie. Our emergency support measures were always designed to be temporary, to get us through the crisis. Thankfully, as the Prime Minister has just pointed out, we're now in a new phase, one that is very different from the darkest days in our fight against COVID. We have recovered lost jobs, vaccination rates are high and will get higher as it becomes possible to vaccinate more of our children. Borders are reopening, and the fourth wave appears to be coming under control in many parts of the country. Last month, as the Prime Minister has just reminded us, we reached our goal, as promised in last year's throne speech, of creating 1 million jobs. Canada has now recovered 100% of the jobs lost in the depth of the COVID recession. And compare that to the United States, which has only recovered 78%. Children are back in school. We have accomplished all of this together while sticking to health restrictions that have saved lives. And by that essential measure, Canada is second only to Japan in the G7. So there are many reasons to be optimistic about what we've already achieved. Our economy is rebounding, and we are winning the fight against COVID. However, it's also true that the recovery is uneven and that the health measures that are saving lives continue to restrict some economic activity. That is why today we are announcing what we very much hope and believe is the final pivot in delivering the support needed to ensure a robust recovery. The existing income and business support programs will end on October 23rd, as previously announced. We are moving from the very broad-based support that was appropriate at the height of our lockdowns to more targeted measures that will provide help where it is needed while prudently managing government finances. And now I'll outline the new programs that we intend to put in place as of October 24th. Premièrement, je vais vous parler du soutien que nous allons continuer d'offrir pour les emplois et les entreprises. Nous continuerons de porter une attention constante aux emplois et à la croissance. C'est pourquoi nous allons prolonger le programme d'embauche pour la relance du Canada jusqu'à 7 mai 2022 à un taux de 50%. Ainsi, les entreprises pourront continuer de réembaucher des travailleurs et de créer les emplois supplémentaires dont nous avons encore besoin. De plus, nous sommes conscients que certaines entreprises sont incapables de répondre toutes leurs activités en raison des restrictions sanitaires nécessaires qui sont encore en place. C'est pour cette raison que nous proposons 2 nouveaux vols de soutien ciblé pour la relance. Le premier vol est le programme de relance pour le tourisme et l'accueil, offrira du soutien aux employeurs par l'intermédiaire des programmes de subvention salariale et d'aide au loyer. On parle ici des hôteliers, des restaurateurs et des agences de voyage qui font encore face à des restrictions visant la santé publique et les voyages. Le taux de subvention accordé à ce groupe d'entreprises très ciblées commencera à 40% pour les demandeurs ayant subi une perte de revenus de 40%. Le taux augmentera en fonction de la perte de revenus jusqu'à concurrence de 75%. The second stream, the hardest hit business recovery program, will be available to employers who can show they have faced deep and enduring losses and will provide support through the wage and rent subsidy programs. The subsidy rate for this group will start at 10% for applicants with a 50% revenue loss, increasing to a maximum 50% subsidy for those with a 75% revenue loss. Support through both of these new streams will be available from October 24th to May 7th of next year. From March 13th to May 7th, the support will decrease by half as we prepare for a full recovery and the end of these extraordinary pandemic-related benefits. The eligibility for these programs will be a two-key system. One key will consider whether the employer has faced a significant revenue loss over the course of 12 months of the pandemic. The second key is revenue loss in the current month. And finally, we are creating a new lockdown support program that will be available in case the pandemic requires further local lockdowns in any part of the country. For those businesses that face temporary local lockdowns, we will make the wage and rent subsidy available up to the maximum amount for the duration of the local lockdown. We're putting this insurance policy in place now to ensure that provinces, territories, and municipalities can continue to make the right public health choices, knowing that support will be there for workers and businesses. Et nous allons aussi tenir notre promesse électorale d'offrir du soutien aux artistes et aux techniciens. Deuxièmement, nous faisons quelques ajustements au programme de soutien aux revenus créé dans le contexte de la pandémie pour qu'il concorde avec la nouvelle phase de la relance. Comme c'est le cas pour les mesures de soutien aux entreprises, nous passons de programmes généraux à du soutien plus ciblé. We're still fighting the fourth wave of this pandemic, and it is particularly virulent in some parts of the country. Temporary local lockdowns are still a possibility in the months to come. We want Canadians to know that we intend now to put in place a measure that would snap into action immediately to support workers in the event of a new local lockdown. As the CRB has done up until now, this new benefit, the Canada Worker Lockdown Benefit, would provide $300 a week to workers who are subject to a lockdown, including those who are ineligible for employment insurance. We also know that Canadians across the country may need continued support from the Canada Sickness Benefit and the Canada Caregiving Benefit. We all need to protect ourselves and one another by staying home when we're sick. And our children, many of whom still cannot be vaccinated, are particularly vulnerable, which means parents may need to be able to stay home to take care of them. So, we intend to extend eligibility for both of these benefits until May 7th of next year, and will increase the maximum duration of each benefit by 2 additional weeks. We estimate the total cost of these measures from October 24th through to May 7th of next year will be $7.4 billion. That compares to the $289 billion we have spent on income and business supports since the start of the pandemic. Notre gouvernement comprend le fier héritage du Canada pour ce qui est sa gestion financière prudente et l'importance de préserver cette tradition de rigueur. Fighting COVID required unprecedented government spending in Canada and around the world. Canadians supported that unprecedented spending because they understood that it was not only the compassionate thing to do, it was the economically smart thing to do. And they understood that providing support to businesses and workers during lockdowns allowed us all to do the right thing together and to save lives. Aujourd'hui, au moment où l'économie se rétablit et des emplois sont créés, où nous nous faisons vacciner et les restrictions sont levées prudemment dans nos communautés et à nos frontières, il est temps d'adapter nos mesures de soutien aux revenus et aux entreprises à ces circonstances plus heureuses. Today, our support needs to be more narrow, more targeted, and less expensive. And we need to look forward to the day, now not too far off, when we will be able to bring it to an end entirely. Our unrelenting objective is to protect and create jobs and to drive economic growth. It is to ensure the strongest possible recovery for everyone. Merci.
Okay, so along with hearing about how they're advancing the vaccination programs, vaccination ID cards, and passports, and the changes in COVID support programs, we also heard about that approvals for vaccination of children between the ages of 5 and 11. So we'll see how that actually progresses with the approvals from NACI and Health Canada. So moving on, we're going to move forward here, and we're going to listen to the British Columbia Premier, John Horgan, and he's going to talk about some of the things that are happening in British Columbia as far as the vaccination ID cards and travel and those sort of things that are affecting British Columbia. Thank you for listening to Depictions Media Radio.
In most jurisdictions, over the past week, an average of just over 2,800 new cases were reported daily across Canada, and severe illness trends are stabilizing. On average, under 2,400 people with COVID-19 were being treated in our hospitals each day, with over 720 in intensive care units, and 35 deaths were reported daily over the past 7 days. As we approach 90% of the eligible population having at least one dose of COVID-19 vaccines in Canada, evidence continues to show that being fully vaccinated provides good protection against COVID-19 infection and excellent protection against severe illness. However, no vaccine is perfect, and there will be instances of suboptimal protection or breakthrough cases. This is why it is important to remember that vaccines must be part of a comprehensive and layered protection strategy that includes other practices and precautions, as well as ongoing monitoring and adjustments. As part of Canada's ongoing commitment to carefully monitor vaccine safety and effectiveness and to update vaccine advice as evidence evolves, Canada's National Advisory Committee on Immunization, or NACI, has updated recommendations to provide Canadians with the best possible protection against COVID-19. NACI's review of the latest available evidence supports, with appropriate clinical oversight, that it is possible to safely provide COVID-19 vaccine to people who experience very rare, immediate, severe allergic reactions after receiving a first dose. This means these individuals can receive the additional doses they need to complete their primary COVID-19 vaccine series and be better protected against COVID-19. As well, Updated information from NACI on optimal intervals between the first and second doses of a COVID-19 primary vaccine series shows that extending intervals beyond those initially authorized leads to stronger immune responses, providing even better protection against COVID-19 infection and severe outcomes. While our protection against COVID-19 has been bolstered by vaccines, as we head into respiratory infections season, we also need to think about protection against other infections. In addition to getting up to date with recommended vaccines, such as influenza and other routine vaccines for children and adults, we can stay healthier by wearing face masks, keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Maintaining our simple, well-practiced habits over the fall and winter will help keep us healthier while easing pressure on the health system for a smoother recovery over the longer term. This goes for planning social events, including Halloween. With a bit of our great Canadian creativity, we can ensure that kids and kids at heart can have fun and safely enjoy this special tradition. Thank you. Merci, Megwitch.
Bonjour à toutes et à tous. Les dernières données de surveillance montrent.
Hello, everyone. The latest surveillance data show a continued decline in disease activity nationally and in most jurisdictions. Over the past week, an average of just over 2,800 new cases were reported daily across Canada, and severe illness trends are stabilizing. On average, under 2,400 people with COVID-19 were being treated in our hospitals each day, with over 720 in intensive care units, and 35 deaths were reported daily over the past 7 days. As we approach 90% of the eligible population having at least one dose of COVID-19 vaccines in Canada, evidence continues to show that being fully vaccinated provides good protection against COVID-19 infection and excellent protection against severe illness. However, no vaccine is perfect, and there will be instances of suboptimal protection or breakthrough cases. This is why it is important to remember that vaccines must be part of a comprehensive and layered protection strategy that includes other practices and precautions, as well as ongoing monitoring and adjustments. As part of Canada's ongoing commitment to carefully monitor vaccine safety and effectiveness, and to update vaccine advice as evidence evolves, Canada's National Advisory Committee on Immunization, or NACI, has updated recommendations in order to provide Canadians with the best possible protection against COVID-19. NACI's review of the latest available evidence supports, with appropriate clinical oversight, that it is possible to safely provide COVID-19 vaccine to people who experienced very rare, immediate, severe allergic reactions after receiving a first dose. This means that these individuals can receive the additional doses they need to complete their primary COVID-19 vaccine series and be better protected against COVID-19. As well, updated information from NACI on optimal intervals between first and second doses of a COVID-19 primary vaccine series shows that extending intervals beyond those initially authorized leads to stronger immune responses, providing even better protection against COVID-19 infection and severe outcomes. While our protection against COVID-19 has been bolstered by vaccines, as we head into respiratory infection season, we also need to think about protection against other infections. In addition to getting up to date with recommended vaccines, such as influenza and other routine vaccines for children and adults, we can stay healthier by wearing face masks, keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Maintaining our simple, well-practiced habits over the fall and winter will help keep us healthier, while easing pressure on the health system for a smoother recovery over the long term. This goes for planning social events, including Halloween. With a bit of our great Canadian creativity, we can ensure that kids, and kids at heart, can have fun and safely enjoy this special tradition.
Merci. Thank you. Miigwech.
Merci, Dr. Tam and Dr. New. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. Opérateur, first question.
Merci, thank you. La première question, the first question, est de Louis Blouin, Radio-Canada. À vous la parole.
Oui, bonjour, Dr. New. Écoutez, j'ai une question pour vous.
Question. Dr. New, I have a question for you. The most recent numbers from Public Health at Quebec show that more than a quarter of parents of children between 5 and 11 will not have them vaccinated against COVID-19. So I wanted to ask you whether parental hesitancy can ultimately undermine kids getting the vaccine. Answer. Thank you for the question. I think there are two different issues here. When it comes to adults, it's important to encourage all adult Canadians, as well as teenagers. We need to encourage them to get vaccinated. And we are using all the means at our disposal, and I'm sure that's the case with the government of Quebec as well, to encourage vaccination. For example, vaccine passports to enable vaccinated people to do more activities. But I think it's a different issue for children, because parents may be considering other issues and concerns. So what I think is that the most important thing is for the regulator, with Pfizer's submission, I think it's very important for the regulator to carry out a rigorous analysis, just as we've seen with other vaccines, like the ones against measles and mumps or polio, in order to ensure that these vaccines for children are safe and effective. If approval is granted, there may be other ways to encourage people to protect their children, but we're not at that stage yet. We are continuing to encourage adults to get vaccinated, and at the same time, the regulator is continuing to study the evidence from Pfizer's submission. Question. I have another question about travel. The Canadian government has had a warning in place for non-essential travel since the beginning of the pandemic. What changed this week to make that rule or recommendation be modified? Answer. Thank you for the question. The COVID-19 pandemic situation is continuing to evolve. And I think we can say that genuinely, the situation here in Canada is better than it has been. But we must not forget that we are still in a fourth wave here in Canada. But vaccine coverage is high in Canada. And we know, based on evidence, that the effectiveness of the vaccine has been well proven to protect against severe illness and hospitalizations, as well as deaths. However, we know that the situation is not the same in all parts of the world. There are regions in the world that are still suffering from the severe consequences of COVID-19. We also know that Canadians are looking forward to being able to make travel decisions for a wide variety of reasons. For those who are going to travel abroad, it's very important to be aware of what the risks and benefits are. What I would say is that it's very important to be fully vaccinated. That is the most important layer of protection. That's something to consider. And also one's state of health. For example, if you're someone with a condition where you're immunosuppressed, that's another consideration to be taken into account before deciding to travel. So given the evolution of recommendations, I think that's something to consider. I think that if you are fully vaccinated and you're in good health, another thing to consider is what the epidemiological situation is in the country that you're going to, because there is great variation between different countries and even within countries, as we've seen here in Canada. It's important to consider the epidemiological situation. And one might also consider the vaccination rate in the destination location, because that's an indication of what community transmission in that region may be. Additionally, one must consider what public health measures are in force in the destination country, as well as border requirements. There is a great deal to be considered. And when Canadians travel, another thing to think about is what activities you're going to do in the destination country. For example, if you're going to go on solitary nature hikes, that's one thing. But if you're thinking of going on a cruise with a lot of people in an enclosed space, that's another thing. One should also consider that one may be visiting a place where the culture for individual protection measures may not be the same as here in Canada. So one should consider whether people are comfortable wearing a mask. So if you're going to a location where perhaps people don't wear masks as commonly, one may feel uncomfortable visiting some spots. So as I've said, there are many considerations and the situation is dynamic. We will also be uploading more recommendations onto our website about further tools in order to get an idea of what the varying levels of risks are in different countries in the world. Thank you.
Thank you. Merci. The next question, la prochaine question is from Glenn McGregor, de CTV News. À vous la parole.
Good morning. Now that Canadians are fully vaccinated who are free to travel, but the requirement for a PCR test 72 hours or sooner upon arrival is a major impediment for a lot of people just because of the cost. People will pay up to $200 US for that test. Family of four, that makes travel essentially impossible. And yet we hear that the data among fully vaccinated people who test positive is very, very low on those tests. Can you still defend this as a reasonable public health measure at this point, given how few people are testing positive, and the fact that it really does unfairly impact people who have lower incomes? They can't travel to the United States for short trips, for example, because the costs are so high. Do you see rescinding that recommendation or possibly replacing the requirement for a PCR test with a less expensive antigen test? Yes,
it's Chrystia here. I'll take this question. I I think those are really great questions, and we'll be examining all of those dimensions. We have been, that's our prime objective, keeping Canada safe. And it is really amazing to see that Canadians have taken up the vaccine and follow public health advice. At the same time as the fact that we're just beginning to come down on this fourth wave, and we need to continue to exercise some degree of caution. But we will be examining all of those layers of protection. We also want to, as we have been doing, staged approach to easing our border measures using data and evidence. So we'll continue to do that. And also we're in the middle of consulting with the provinces as we speak, and on what the needs are for testing with regards to vaccinated travelers. I have to remind people that the pandemic is very much alive outside of Canada, and that many countries continue to require a pre-departure test, and it adds a layer of protection for any traveler, not just Canadians coming into Canada, but travelers from any corners of the world. So it is something that we will look at, but you know, we are definitely not out of the woods yet. The next months, as I describe it, one would expect some ups and downs, some bumps along the way in our pandemic trajectory. And we just got to be a bit careful as we beginning to head into the winter season and trying to keep our schools, workplaces, and other socially and economically important spaces open as much as possible. We've got to be really careful if we are going to lift any layers of the protections pertaining to the border. But we are examining all of those measures as we speak.
As a follow-up, Ontario today is expected to announce they're going to easing back on capacity restrictions in restaurants, bars, gyms, and also maybe considering setting out a timeline for ending the mask mandate. And on those 2 points, what do you think of easing capacity or eliminating capacity restrictions on restaurants now in Ontario? And also, at what point do you think it would be safe for people to stop wearing masks in public places?
Well, first of all, the requirements in Ontario are best directed towards Ontario, the provincial government, because as you've seen across Canada, every province and territory has a different epidemiology at the moment. On the whole, though, as I said at the beginning of my presentation, is that we are beginning to see the downward side of the fourth wave. And I think Ontario would have assessed their own particular situation, which has been looking pretty good to date. And so I am sure that the public health officials will be monitoring COVID activity as they begin to ease these measures. And so I think slowly and gradually and continue to monitor the situation is very important. What we have learned, and through our modeling studies as well as, of course, real-life experience, is that if everyone continued to wear masks in enclosed, crowded, close contact spaces and continue those personal hygienic measures, it can actually help reduce transmission rates in a community. So whether there is a mandate or not, I think adding those layers of protection can potentially help reduce the rate of resurgence and keep your community safe. So that would be my advice. And listen to your local public health authority, because the activity is different everywhere. So if you got a lot of disease activity going on in your community, absolutely add on the extra layers of protection. And of course, as Dr. New has said, you've got to do your personal risk assessment as well. If you're at high risk of severe complications, you would take really great precautions, I think, as you're entering those, what we call the 3 C's, crowded, enclosed, and close contact spaces. And that's just the prudent way to get ourselves through the winter. And by the way, we did say that we're seeing other respiratory viruses escalating right now. Not yet influenza, but those viruses are escalating, and they can have an impact on our health system as well, and that some people can get sick from other viruses. So adding on those layers of protection can only help to protect our health system as well, and of course, get the flu shot.
And it's Dr. New here. Maybe I just would add an additional point to what Dr. Tam has said, is that certainly our provincial territorial colleagues are all very live to the issue of the importance of continuing to monitor in terms of good surveillance and being able to pivot, because as they slowly maybe loosen restrictions and public health measures, if there's any indication that case counts are rising and hospitalizations and other indicators are starting to trend in the wrong direction, they need to be able to pivot quickly and long before obviously we get to stresses on the healthcare system. So I think that's the one point that I think everyone is now taking to heart, that we need to be able to adjust as quickly as need be as we slowly loosen public health measures. Thank you.
Okay, so continuing forward on our hot topic item of vaccination, to be vaccinated, not to be vaccinated, and Canada has issued, different provinces have been issuing vaccination ID cards. And now the federal government is introducing a program with a national vaccination passport. This passport can be used to travel on the planes, on a bus, or any of those things, any of those modes of transportation that are governed by the Federal Ministry of Transportation. So, in a nutshell, is being vaccinated, it's like most healthcare, it is a private issue. It is not a matter of a public record. The different types of treatments and things that your doctor performs on you. Should the COVID-19 vaccine be a public thing? Should it be a matter of public record? And are these ID card programs actually segregating populations when our government should be helping populations? They should be helping people come together, be united, be part of a solidarity group. So, this is the big question about the vaccination ID cards. So let's listen to, we're going to listen to what Justin Trudeau and has to say about this topic. Along with that, the federal government is going to start repealing COVID supports. Now they're going to replace them with some newer programs that will end by May 7th of 2021 in most cases, but they're going to start repealing the COVID-19 supports. Now, according to statistics, that more jobs have been created after the vaccination programs have been introduced than there were before the pandemic first hit. So there are some arguments about how to keep support programs going. and which programs need to be continued to be supported, because they want to introduce the idea of, hey, if you feel sick, don't go to work. There's other things that possibilities of lockdowns and things like that could happen, and they want to make sure that there is some sort of support in place for that in case there are a large number of breakout cases beyond the vaccination programs. So let's listen to what Justin Trudeau and Chrystia Freeland actually have to say about all that. Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.